If you enjoy this podcast summary, please consider subscribing and check out links in description for Apple Podcast and Spotify to listen 8 to 10 podcasts every week. Dr. Mark Hyman, a medical doctor and leader in functional medicine, shares his personal journey of getting sick with chronic fatigue syndrome and how it led him to discover the importance of understanding the body as a network and a system. He explains that functional medicine is not just about diagnostic testing or supplements, but about understanding the network of the body and how everything is connected. Dr. Hyman's approach is based on the laws of biology, which he believes are the first clinical application of this understanding. He shares how he applied these principles to his patients and saw significant improvements in their health, including a patient with psoriatic arthritis who was able to eliminate all her symptoms and stop taking medication after following a simple program. Dr. Hyman emphasizes that functional medicine is about creating health, not just treating disease, and that by optimizing the body's basic systems, symptoms go away. He also discusses how the medical establishment viewed his approach and how things are changing, with more recognition of the importance of nutrition and lifestyle in health. Dr. Hyman's work is unique in that it integrates conventional medicine with what he calls good medicine, which is an amalgamation of the best practices from both traditional and alternative approaches. He shares his expertise on a diverse range of topics, including food, exercise, and supplementation, and grounds his knowledge in the latest discoveries in human biology. Dr. Hyman's approach is inclusive rather than exclusive, and he wants to know everything about his patients, including their history, lifestyle, and environment. He believes that inflammation is the root of many chronic illnesses, and that by treating the gut and addressing inflammation, many symptoms can be eliminated. Dr. Hyman's work is not just about treating disease, but about creating health and wellness. And he believes that by understanding the body as a network and a system, we can take control of our health and well-being. He thinks that understanding the complex interactions between different systems in the body is crucial for achieving optimal health. Hyman emphasizes the importance of considering the exposome, which refers to the sum total of everything an individual is exposed to, including environmental toxins, diet, and lifestyle factors. He notes that the exposome is far more predictive of health outcomes than an individual's genome.
Andrew Huberman points out that many physicians, unlike Dr. Hyman, don't always look very healthy, which can be a concern for patients. Hyman jokes that he looks pretty good for 100, and Huberman agrees that he appears vital and healthy. Huberman notes that understanding systems biology and health is essential for people to take control of their well-being.
Dr. Hyman explains that functional medicine is about identifying the underlying causes of disease and designing a treatment plan based on those causes. He lists several key factors that can disrupt normal function, including toxins, infections, allergens, poor diet, and stress. Hyman emphasizes the importance of eating whole, unprocessed foods such as fruits, vegetables, meats, and quality dairy products.
Andrew Huberman asks Dr. Hyman about his view on seed oils, and Hyman expresses some concerns about their potential health impacts. He notes that while some studies suggest that seed oils may be beneficial, the data is mixed, and more research is needed.
The conversation turns to the topic of nutrition, and Dr. Hyman emphasizes the importance of eating foods that are close to nature. Hyman notes that the combination of fat and starch, particularly when combined with sugar, is a major contributor to health problems.
Andrew Huberman asks Dr. Hyman about his view on the seed oil debate, and Hyman notes that while some seed oils may be problematic, the data is not yet conclusive. Huberman predicts that seed oils will eventually lose out to more natural options like olive oil and butter.
Dr. Hyman notes that if he had a magic wand, he would get rid of highly refined sugars in the modern American diet. He believes that starch and sugar are driving the metabolic crisis, and that reducing their consumption would have a significant impact on public health. Hyman emphasizes that it's not about eliminating certain foods entirely, but rather about reducing the volume of unhealthy foods in the diet. The conversation turns to the topic of how the American diet has changed over time. Dr. Hyman notes that the rise of cardiovascular disease in the 1970s led to a shift in dietary guidelines, which emphasized the importance of reducing fat intake. However, this approach has been widely criticized, and many experts now believe that it contributed to the rise in obesity and type 2 diabetes. Hyman notes that the American public trusted the government and scientists at the time, but that this advice has since been proven to be misguided. This led to an explosive rise in obesity, diabetes, and other health problems. Dr. Mark Hyman emphasized that sugar and starch are the main culprits, not fat or cholesterol. The conversation then shifted to the importance of nutrition and how it's not as complicated as people make it out to be. Dr. Hyman believes that nutrition should be straightforward and that people need to focus on eating the right foods and avoiding the wrong ones. He also emphasized the importance of individualized nutrition, as people have different genetic needs and requirements.
Andrew Huberman brought up the topic of functional medicine, which involves taking a holistic approach to health and addressing the root causes of diseases.
Dr. Hyman explained that functional medicine is about removing the bad stuff and putting in the good stuff, and that each person has a unique set of bad stuff and good stuff. He also emphasized the importance of being a detective and figuring out what's going on in each person's body. The conversation then turned to the topic of supplements and whether they're necessary. Dr. Hyman believes that while people should try to get nutrients from food, there are some things that are difficult to get from diet alone. He listed omega-3 fats, vitamin D, and magnesium as essential supplements that most people need. He also emphasized the importance of choosing high-quality supplements that are bioavailable and well-absorbed.
Andrew Huberman shared his own experience with supplements and how he's been taking them for 35 years. He also emphasized the importance of third-party testing and finding reputable sources for supplements.
Dr. Hyman agreed and added that it's essential to choose supplements that are made with the right forms of nutrients, such as magnesium citrate or glycinate. Dr. Hyman emphasized that functional medicine is about getting to the root of the problem and addressing the underlying issues, rather than just treating the symptoms with medication. However, he notes that most people won't go to such great lengths to figure out their nutrient requirements.
Andrew Huberman agrees, highlighting the importance of getting the basics right, such as magnesium, omega-3, vitamin D, iron, zinc, and selenium.
Dr. Hyman emphasizes that it's crucial to test for nutrient deficiencies rather than guessing, as individual needs can vary greatly.
The conversation turns to the topic of supplements, with Andrew Huberman asking if the list of essentials they discussed earlier would be beneficial for most people to add to their diet.
Dr. Hyman agrees, noting that while some people may not need certain supplements, it's better to err on the side of caution. He also mentions the importance of iodine, which is often lacking in modern diets due to the shift away from iodized salt.
Andrew Huberman brings up the topic of methylated B12, asking if there's a danger in taking it if you don't need it. The discussion then shifts to the medical community's skepticism towards supplements. He attributes this to a lack of understanding about the value of nutrition and supplements. Andrew Huberman notes that the younger generation of physicians and scientists is more open to the idea of supplements and nutrition, and that the field is slowly shifting towards a more holistic approach.
Dr. Hyman agrees, citing the work of Roger Williams, who discovered pantothenic acid and wrote about biochemical individuality.
The conversation then turns to the topic of air quality, with Andrew Huberman asking about the state of the air in the United States.
Dr. Hyman notes that while the air quality is generally better in the U.S. than in developing countries, there are still areas with poor air quality, particularly in urban areas.
Andrew Huberman asks about the impact of running and breathing in polluted air, and Dr. Hyman notes that while it's not ideal, it's not necessarily a major concern for most people. However, he emphasizes the importance of managing exposure to toxins and pollutants.
The discussion then shifts to the topic of water quality, with Dr. Hyman noting that tap water often contains contaminants such as pesticides, glyphosate, and hormones.
Andrew Huberman asks about the cost of being healthy, and Dr. Hyman notes that it's a myth that healthy living is expensive. He emphasizes that many foundational aspects of health, such as exercise, sleep, and stress management, are free. He also notes that eating real food doesn't have to be expensive, and that there are many affordable options available. The conversation then turns to the topic of American cuisine, with Andrew Huberman noting that there isn't really a distinct American cuisine.
Dr. Hyman agrees, attributing this to the industrialization of the American food system after World War II. He notes that the shift towards processed and industrialized food has led to a lack of pride in healthy food and a commodification of food. Dr. Hyman shares a personal anecdote about his grandmother's food culture, which was influenced by her ethnic past. He notes that the industrialization of the food system has led to a loss of traditional food cultures and a reliance on processed and unhealthy foods. They discuss how the industrialization of food production led to the creation of processed foods, which were marketed as convenient and affordable. However, this shift away from whole, nutrient-dense foods has contributed to the rise of chronic diseases such as obesity, diabetes, and heart disease. Dr. Hyman notes that the food industry has successfully disenfranchised people from their kitchens and hijacked their brain chemistry, metabolism, and hormones. He emphasizes the need for individuals to take control of their health and biology, rather than relying solely on doctors or the medical system. The conversation also touches on the topic of self-directed health and the pushback against IT.
Andrew Huberman shares his personal experience of being teased for prioritizing his health in college, and how it takes self-confidence and determination to make healthy choices in a society that often values convenience over nutrition. The discussion turns to the topic of MAHA, or Make America Healthy Again, and the pushback against it.
Dr. Hyman notes that the issue of health has become polarized, with some people viewing it as a partisan issue. However, he believes that there is bipartisan interest in addressing the root causes of chronic disease and promoting healthy lifestyles.
Andrew Huberman emphasizes the need for a cultural and medical revolution to address the rising rates of chronic disease in America. The conversation also touches on the topic of toxins in food and the environment.
Dr. Hyman notes that while the amounts of toxins in food may be small, the cumulative effect of exposure to multiple toxins over time can have serious health consequences.
Andrew Huberman agrees, noting that the precautionary principle should be applied to food additives and environmental chemicals, and that human trials are needed to fully understand their impact on human health. By taking control of our own health and biology, and by promoting healthy lifestyles and main learning from video.
Dr. Hyman, a leader in functional medicine, shares his personal journey of getting sick and how it led him to discover the importance of understanding the body as a network and a system. He emphasizes that functional medicine is about creating health, not just treating disease, and that by optimizing the body's basic systems, symptoms go away. The conversation covers various topics, including the importance of nutrition, the role of toxins and inflammation in chronic illnesses, and the need for individualized approaches to health. Dr. Hyman also discusses the importance of testing for nutrient deficiencies and using supplements to support health. The conversation highlights the need for a cultural and medical revolution to address the rising rates of chronic disease in America and the importance of promoting healthy lifestyles and policies. Key takeaways include the importance of eating whole, unprocessed foods, reducing exposure to toxins, and using supplements to support health. By taking control of our own health and biology, and by promoting healthy lifestyles and policies, we can begin to address the root causes of chronic disease and create a healthier, more sustainable food system. If you are interested to listen to complete 21-minute summary and unlock detailed insights for each topic discussed in the video, check out quick podcast summaries on Spotify and Apple Podcasts with free trial, and later, just for the price of candy. Happy listening.